Hi, Regan Gibson here. Today we're going to be performing the postpartum patient checkoff video. I'm going to start with my COEP. I'm going to check the orders and check the patient's allergies. I'm going to assess the patient and assemble my supplies. I'm going to wash my hands and don gloves. I'm going to identify myself and identify the patient using two identifiers. I'm going to provide for privacy, and then I'm going to educate, explain, and evaluate. So first, I'm going to assess the vital signs. I'm going to listen to the heart sounds and the lung sounds and also the bowel sounds to make sure that they've returned. And then I'm also going to assist the patient to use the bathroom, and then I'm going to assess the output, how much it is, if there's any clots, any odor, things like that. So first we're going to assess the breast. I've chosen to do this presentation as if it was a one-day postpartum. So with the breast, we're assessing for tenderness, engorgement. We're checking the nipples to see if there's any cracking or bleeding. We're going to assess the bra to make sure that the nursing bra, she's wearing it properly, things like that. And then we're also going to check and see if she's lactating versus non-lactating. One day postpartum, we should be able to see some colostrum production going on, so we just want to make sure that everything's working properly in that area. So then next, we are going to be checking the uterus. So we want to check the fundus position and the size. For a one-day postpartum, it should be about 1 centimeter or 1 finger width below the umbilicus. So we just want to place our hand on the abdomen and push down until it should feel firm, but if not, that would be boggy. And if we did have a boggy uterus, we would want to start that fundal massage. When you're doing a fundal massage, you want to make sure you have your supporting hand above the symphysis pubis, and then do the massage with the other hand to make sure that you're not pushing anything out going down that way. So after that, we move on to the bladder. So with the bladder, we are checking to see if it's distended, and we're assessing if she has a Foley or if she's voiding. We're going to assess when her last void was, and like we said in the beginning of this video, we should be assisting her to use the bathroom before we even begin. And then after bladder, we move on to the bowels. We want to assess when her last bowel movement was, if she had any complications, if she's constipated. And if she is, we want to make sure that we assist with that because especially with women who've just had babies, they're prone to hemorrhoids. So any kind of straining with the bowel movement is just going to be really uncomfortable and make those flare back up. So after bowels, we move on to the lochia. We want to assess the patient's perineal area and the pads, and we want to make sure that we change them whenever they're soiled. For a one-day postpartum patient, we should be experiencing lochia rubra, which is just straight red blood. We want to note the presence of clots, and if there are, we want to, again, do the fundal massage. We want to note the amount, the color, how many pads the woman is going through, or the weight of the pads. After lochia, we move on to the episiotomy, if she's had one. And with the episiotomy, we want to note the location. We want to use the REDA acronym. We're looking for redness, edema, the ecchymosis, drainage, and approximation with that. Again, we want to note the presence of hemorrhoids, and then perineal care. There's several different techniques that comes with pericare. She may have to do a sitz bath, or benzocaine cream or spray, the EpiFoam, or the use of the peri bottle. And from personal experience with the peri bottle, we want to make sure that we inform her that it is simply warm water. So she can empty it and replace it with more warm water each time she goes to the bathroom. So after episiotomy, we move on to legs. So we're checking for any pain that she's having. We want her to rate it on a scale of 1 to 10 and note the location. And we're looking for any redness and edema all in the lower extremities. We're also going to be checking for the circumference of the affected extremity if that's applicable. So then we move on to the emotional state. We want to check to see if she's moody, if she's happy, depressed, just kind of what state she seems to be in. We want to check to see if she's making eye contact with the baby, and if not, one good technique to get her to start making eye contact with the baby is to point out things like their eye color or their hair or things like that, just to get her focused on the baby's face and start that bonding between the two of them. We're also going to assess her when she's holding the baby. Is she taking the on-face positioning? Is she touching the baby with just her fingertips? These are all kind of cues as to how well the mother is bonding with the baby at this point. Is she responding to the infant's cries? At 1 day postpartum, the mother is most likely not going to be able to recognize what the baby's hungry cry is, or the tired cry, things like that, but she should still be, responding to the baby whenever the baby starts to cry. So then last, we are going to be assessing her energy level. This goes along with her nutrition. Is she eating? Is she sleeping? Is she active? Things like that. And then after that, we are just going to document our findings. Thank you.